What I'm really excited about this opportunity is to really engage the community as equals and as partners.
That's Kansas City, Missouri's incoming health director, Dr. Marvia Jones. Tomorrow, she'll make history when she begins her first day on the job. Dr. Jones is the first black woman appointed as health director. She served as Kansas City's violence prevention and policy manager, also spent some time with the Centers for Disease Control. Dr. Jones replaces Dr. Rex Archer, who retired in August after 23 years with the city. And Dr. Jones joins us now on Heart of the Matter. First, congratulations and thanks for taking the time to stop by before you jump into this new role. Okay, so tomorrow you open the door, you sit down at your desk. What's your first item on your list?
Yeah, my first item is to reach out to staff and make sure that they feel replenished, figure out what needs to be done actually to make them feel ready to continue the work.
You've talked about morale being an issue at the department. What do you mean by that?
Well, I think in the same way we've heard from nurses and doctors across the nation in medical settings where people have been working so hard through this COVID surge and just the nearly 2-year thing that we've been dealing with with the pandemic, and people are feeling just really burnt out. And so I think it's incumbent on leadership to make sure that their pitchers are refilled.
You talk about this, and the role of health director is important, but it's become even more so because of COVID-19 and the pandemic. How do you rally the troops, and how do we push past COVID as a city?
Right. I think that we really have to entreat all public health workforce as if they are our partners. You're not just the person who shows up every day and works. You're our biggest ambassador to the community. And so really making sure that they feel heard, they feel understood, they understand what we're messaging, and they can go out and do a better job of making sure that the community understands. What I'm really excited about this opportunity is to really engage the community as equals and as partners.
That's Kansas City, Missouri's incoming health director, Dr. Marvia Jones. Tomorrow, she'll make history when she begins her first day on the job. Dr. Jones is the first black woman appointed as health director. She served as Kansas City's violence prevention and policy manager, also spent some time with the Centers for Disease Control. Dr. Jones replaces Dr. Rex Archer, who retired in August after 23 years with the city. And Dr. Jones joins us now on Heart of the Matter. First, congratulations and thanks for taking the time to stop by before you jump into this new role. Okay, so tomorrow you open the door, you sit down at your desk. What's your first item on your list?
Yeah, my first item is to reach out to staff and make sure that they feel replenished, figure out what needs to be done actually to make them feel ready to continue the work.
You've talked about morale being an issue at the department. What do you mean by that?
Well, I think in the same way we've heard from nurses and doctors across the nation in medical settings where people have been working so hard through this COVID surge and just the nearly 2-year thing that we've been dealing with with the pandemic, and people are feeling just really burnt out. And so I think it's incumbent on leadership to make sure that their pitchers are refilled.
You talk about this, and the role of health director is important, but it's become even more so because of COVID-19 and the pandemic. How do you rally the troops, and how do we push past COVID as a city?
Right. I think that we really have to entreat all public health workforce as if they are our partners. You're not just the person who shows up every day and works. You're our biggest ambassador to the community. And so really making sure that they feel heard, they feel understood, they understand what we're messaging, and they can go out and do a better job of making sure that the community understands.
You mentioned community engagement being one of your priorities.
Yeah.
We talked with Councilwoman Melissa Robinson last week here on the show about inequities in healthcare, especially in the black community. You're a person of color. You are the head of the health department now. How do you bridge that gap? How do you tackle that problem?
Yeah, we've been talking a lot about how do we restore trust with the community. So the public health, as a field, we realize we have lost some trust through the pandemic, and so we really want to engage with them, be present, to be available, hear their frustrations. So the community has some frustrations about our messaging. How do we hear that and make sure we course correct based on what we're hearing?
Why do you think you've lost trust?
I think we've lost trust because we haven't done a good job of meeting people where they are. We use maybe language that people don't understand. We've had to change directions quite a few times. And all of that can, over time, unintentionally lead to reduced trust.
Sure. There's been a lot of political pressure, too, as you've seen before you step into this role, especially from Missouri's Attorney General, who's challenging the legality, the authority of cities like Kansas City to impose their own masking rules. How do you think the city's role plays out moving forward? Do you support masking rules and mask mandates?
I really support following the science, and I really appreciate that we seem to have really smart local council people, mayor's office, people who listen to public health guidance and then make those decisions. So I support doing what we need to do when we need to do it.
Does that mean extending this school mask mandate that's in place right now?
You know, I think we're still reviewing data. I think it's still coming in. We want to make it educated, not just, based on what we feel. So we want to make sure that we follow the data, and I don't have that with me right now.
No, I understand.
Yeah.
Of course, Kansas City has much more to contend with than just COVID. Like, the world keeps spinning outside of the pandemic. What are the other major challenges that you want to tackle?
Yeah, violence prevention is something that we've been working on for a long time. Hopefully in this role I'll be able to take that to another level and really bring the community into that discussion in a way that maybe they haven't been engaged before.
Now, you mentioned violence. You've specifically called gun violence a public health crisis. Mm-hmm. What do you mean by that? And it was interesting to me, it hit my ear a certain way, because you usually don't hear a public health director talking about gun violence. Yeah. How do you work on that in Kansas City?
Yeah, I think by first helping people understand how it impacts people. Like, it's not like someone gets shot or a family loses a loved one and then the next week they go back to normal. What we know is that people's financial status changes after the loss of a loved one. Even if they survive, that family is now hit with medical costs. Someone has to maybe quit a job to take care of them. And so that jeopardizes the well-being of all the other dependents in that household, and can change the course of their future. And so then we're dealing with more problems down the line. And so I really want people to see that there are things that we can do now to get ahead of that so that we can curb, it's not going to change in the next 2 months perhaps, but over time we'll see a reduction.
Right, and I think you make a good point about having this dialogue, because so much feels like, mandates. The government is telling me I need to wear a mask. The government is telling me this. It just seems like a key component, and we wish you the best of luck with that.
Thank you.
All right. Dr. Jones, thanks so much for your time today.
Thank you.